pretty annoyed at the reporting about the changes that are trying to be made in healthcare. And I want to come on here because I wanted to let you know that it is misleading. The reporting that is being done from all the different sources is highly misleading. I see news reports about this physician's group and this doctor's group and that doctor's group, and the AMA says this, and the National Institute of Health says this, and the FDA wants this, and X, Y, and Z. This is what I hear. We've been sucking on the teat of the healthcare dollars for decades and not getting any results. That's what I hear. And now you're taking away our source of revenue and we're losing our minds about it. That's what I hear. I hear that people are like, oh no, but what about the research? What about the science? It wasn't working, y'all. It was not working. The United States is 4.2% of the world's population. We consume over half of the medication produced on planet Earth. We consume about 90 plus percent. I've heard 90 plus 95% and more percent of all the painkillers produced on the planet. And yet our health index is it's just horrible. Our child mortality rate, infant mortality rate is above that of some third world countries. Our longevity, our cost of healthcare per citizen, all these things are in the toilet compared to other places. And we're sitting here saying that if we stop the funding, our health indexes are going to go down. We're going to be in worse shape than we are now. It isn't working now. We've got to change something. And it's got to be changed fast, because 20% or more of our whole entire, every dollar spent in this country is spent on healthcare, and we're not getting anything for it. Something that I think that's important for people to know is the AMA, the American Medical Association, who sort of dictates a lot of healthcare policy. They own all the billing codes. They own the rights to all of the billing codes. So what that means is what your insurance company covers, what your insurance company is going to pay for you to get healthy and well, is dictated by the American Medical Association, because they dictate the codes. So you go, well, I thought the insurance company did that. No, the AMA controls those codes. The insurance company can dictate what to pay, but the AMA actually owns the rights to the codes. And you say, well, that means all the doctors are saying what needs to be covered, because the American Medical Association is a bunch of doctors, right? It is not. Less than 10% of practicing physicians belong to the AMA, less than 10%. Most doctors that I know say, the AMA, oh, that's the drug companies. So do a little bit of research on this. Don't take my word for it. But over 70%, the last time I looked into this was last year, over 70% of the entire AMA's budget is funded by the American Pharmaceutical Advertising Council. So the drug companies are telling the AMA, essentially they own the AMA, they fund the whole thing, so they own it. The drug companies are telling the AMA what codes to use. The AMA is then filtering those down to the insurance companies. So the drug companies are the ones that are dictating what's done in this country regarding healthcare. So I don't believe that it's the physician groups that have their panties in a wad, so to speak, about all this. I believe that these groups are funded by the pharmaceutical companies. I believe doctors want to see change. Maybe not all of them, but the vast majority of doctors know that the way we're doing things is unsustainable. They hardly even practice medicine anymore. They just prescribe drugs. They walk into a room, they get to spend 8 to 10 minutes with a patient at best, and 93% or more of every doctor's visit results in a prescription being written. They're just drug pushers. That's nothing against the doctors at all. I'm just telling you that's the way the system is run. It's ridiculous. Anyway, I'm curious what your thoughts are on this. I really think things have to change, and I'm trying to encourage people, don't pay attention to all the talking heads out there that nobody wants what's happening as far as reform goes. Almost everybody that I know, medical doctors, DOs, nurses, they all are on board with some sort of reform and change. Some of them are like, oh, this doesn't make sense. This is what I learned in school. Well, maybe so. But if you really want to see change, something is gonna have to change. And the statistics bear out that what we're doing now isn't working. Something's got to evolve.